person I do see in their building.
Who's that?
Carol Kleinman. Yeah.
And Grace, I'm here to say
Grace.
congratulations, muzzle top, and all other good wishes.
Oh, thank you so much. I'm trying to see you. Are you on,
I'll highlight Grace for a moment.
Grace?
There's
Hello.
Grace.
Oh, there you are.
There you go.
Grace. Grace is a fellow social worker and a fellow artist, much better artist than I am, but we do meet with social work issues and art issues as well. And she's
Lovely.
We have lots of connections.
and a good social worker.
And Nona's here.
Who?
Hi.
Trying to get it.
Oh, no.
Hi. Yes, here I am.
Who's that?
Why is it blurry?
Oh, there's Nona and Wendy. Hi, Nona.
Yeah, hi, baby. I'm trying to figure out why Nona's blurry.
Nona's blurry because they're sharing a screen together, I think.
Oh, is that what happens?
Yeah, and then they could unblur their background if they'd like
Okay,
to.
yeah, I can, right.
I don't.
These are neighbors, wonderful neighbors of ours.
Yes.
Nona and
Joan is blurry too. Joan is blurry also.
I'm blurred.
Now
you are.
Now you're
Now
good,
you're
Joan.
on.
Yeah, I
Okay.
think you have your blur background on, and
Oh, there
sometimes
I
when
am.
you move,
I
that's
just
right.
turned
'Cause
it off.
Oh,
Yeah.
Stan. There's Stan. It's nice to meet
there.
you.
Yeah.
Pretty
Good.
Jason.
All right. Well, we're going to get started. And I'm going to mute everyone just to start, and then we're going to have a lot of opportunity for a variety of people to speak so that we can all greet Joan. So I'm going to mute everyone right now. Okay, so welcome everybody. It is my great pleasure to welcome you to this celebration of our founder, Joan Weiss. We'll have a very simple and pretty informal agenda today. I'm so delighted with everyone. I'm a little speechless. So we'll start with some remarks by Mary Davidson, who took the reins after Joan Weiss and worked closely with Joan. I will then present some of the accolades and other photos, et cetera, that have come in over the days that we've been putting this together. And Joan, all of that will be given to you in a photo album of sorts, a hard copy book. And then we're going to open the floor for any comments from anybody, and we'll use our allotted time. We have about an hour and a half together. I'll spotlight people as you speak so that we can see who you are. And then, Joan, we'd like some comments from you at the end of all that, and then just some open time if people want to stick around and say anything further. So without further ado, I'm going to turn the baton over to Mary Davidson. And Mary, you're muted because I did mute everybody.
There. All right. Hello, everyone. This is just a wonderful, so many people, so many faces, so many memories associated with so many faces. And I'm just so thrilled to be here to honor Joan. And I also just want to thank everyone for taking time. And I know your very busy lives, but I think, like me, you share an awe for this amazing woman, and you wouldn't have missed this for the world. Joan is wise, wonderful, very hardworking, and productive. I mean, just look where we are now. And she's made, you, Joan, have made such a difference to, I can say, I think each of us personally and professionally, and to the world of genetics at large. And that's why we all made time. Look at all the numbers of us. And I know there are many more who wanted to come but couldn't, and are sending their greetings and their love and their appreciation. But we're all here to salute you. And in that vein, I'm going to read my salute to you. In 1996, I had the pleasure of being chosen as the second executive director of the Alliance of Genetic Support Groups. I was following and trying to fill in the huge footsteps left by you, Joan, the founder of the Alliance, who was retiring. Joan was and is mythical and yet very real, a hero to so many people of all ages, children, teenagers, adults, families who struggle with genetic conditions in a world at that time, a world, including the medical community, which didn't understand and in most cases couldn't treat their conditions. But also a hero for leaders of genetic disease support groups who valued her many years of experience and wisdom garnered as a social worker at Johns Hopkins Hospital. Empathetic, inspiring, empowering, encouraging, uplifting, all with a heart of gold, wry humor, and an easy laugh, and that smile. That's Joan Weiss. That's you, Joan. And look at the legacy you left us. Now the Genetic Alliance, but still the coalition of families, support groups, and medical and policy professionals united in a grand effort to make the world a better place for people with genetic conditions. And that means a better place now, really, for all of us. So, John, it's too early in the day for champagne, at least for some of us. So I salute you with tea, Bengal spice, since this is my go-to tea since COVID. I salute you with tea and a warm and appreciative and affectionate heart for your inspired vision, your welcoming outreach, your towering leadership, and the young and budding organization overflowing with potential that you handed off to us. We felt we'd been given a pot of gold, the chance of a lifetime, as indeed we were. So thank you, Joan, from the bottom of our hearts, from the bottom of my heart, for that and for so much more. Wait, can you take Joan off mute?
Joan, you're going to have to unmute yourself. They no longer let us do that. Sorry. I will leave you unmuted, Joan, from here on. They don't let the host unmute anymore. Is your tech help there still? I wish they did let the.
It's
There we go.
Yeah, they finally found the right symbol to push.
Yes, good job.
Thank you. Thanks so much, Mary. Lovely work. I really appreciate it. And appreciated working with you a little before I totally retired.
Well, you are amazing. And so it was kind of hard to put all of that in words. No, there isn't any particular adjective that captures it. And that's why it required so many. But you really have left us quite a legacy.
Thank you. I had a lot of help along the way.
And one I can say that Sharon Terry has run with.
Yes, well, I follow two amazing leaders. So, yeah, wonderful. All right, so we're going to now move to a slideshow that I put together the help of Mary Pekakonis, and a lot of you sending in photos, which were just fabulous. And they're not all in here. And as the slideshow is going, I'm going to just also recant some of the history here, so that all of us can kind of remember that so much history is here. Genetic Alliance turns 40 in 2 years. I really have a strong feeling that nonprofits should remember their history, and remember where they came from, and that in all history, our remembering is really critical. And so I'm going to recant a bit of that. The slides will move moderately quickly. Again, Joan, you will get them all in a book. This is being recorded, and so any of you can look at this later as well.
Wow.
And then there also were many, I think we had a couple hundred well-wishers send good wishes, Joan, and some of them wrote some things. And so those will also be in the book because they're too numerous to read.
Oh,
And
wow.
then we're going to open this up for others to make comments here. So without further ado, I'm going to move on to the slideshow.
Slideshow. Wow.
And let me just find it. Sorry, I'm having a little bit of I have really bad internet. So here we go. Back to the beginning. Okay. All right. All right. So just to orient us a little to the world that Joan Weiss walked into many decades ago now was a world where she began with inspiration from her own son who had suffered from genetic conditions, and one in which Victor McCusick played a role. And so I'll describe some of that as we see some of the other slides that we'll just move on through. And as Mary Davidson mentioned, this is the Alliance of Genetic Support Groups. That's still the official name, and it's AKA, also known as Genetic Alliance, to say that slowly. So Joan came into a world as a social worker, master's in social work, knowing that there were many advocacy organizations out there. There were disease support groups. There were, some of you might remember things like the Cystic Fibrosis Foundation in the early 70s, the early 80s. We have Marjorie Guthrie working her stuff through the Huntington's Disease Association and so on. But even just the profession of genetic counseling in the 70s was the beginning of so many things. And the Alliance's beginnings were around 1983. Families and professionals came together at a symposium entitled Genetic Disorders and Birth Defects in Families and Societies Toward Interdisciplinary Understanding. And this meeting, this symposium, acknowledged the need for voluntary genetics organizations to share information with one another, with professionals, and with scientific research and policy organizations and the general public. That was 83. In 85, NORD was established, the National Organization of Rare Disorders, and NORD's focus was on rare disorders. There seemed to be a need to talk also about genetic disorders, that they weren't all rare and that they also had a slightly different flavor than some of the rare conditions. And so there was a second symposium in 1985, and that one was called Genetic Support Groups, Volunteers and Professionals as Partners. And Victor McCusick called on the attendees there to form a Congress of Genetic Support Groups that can speak with one voice. Joan took up that banner and formalized a steering committee of leaders of national support groups and representatives of professional organizations to make one national coalition of consumers focused on genetics. Joan had always been a leader in genetics and social work, but this focus on genetics really moved her in a particular direction that remained part of her career the rest of her life in terms of her work. Her actual career spanned some 4 decades, and she's always been a very effective advocate for individuals with genetic disorders. And her work and contributions are on the leading edge, cutting edge of genetics even still. We're still fighting for a whole lot of the things that you, Joan, fought for, the voice of the family in anything we do. And we have generation after generation forgetting that that's an important piece. You were a leading spokesperson for the role of social work in the growing field of genetic research and education, and you lectured and had workshops everywhere in the United States and Europe, and you published several books on the field of genetics and social work. Starting and sustaining an advocacy group was one very critical work that lots of us relied on who came along after you. So you were, as we are celebrating today, the founder and the first executive director of the Alliance of Genetic Support Groups. You also served as the co-director of the Human Genome Education Model Project, HUGEM, and it was internationally recognized as the premier genetics education project for health professionals that seek to include consumers at all levels of policy, education, and research, a banner that Genetic Alliance continues today. And you were so instrumental in establishing partnerships that we rely on today still. Your career began at Johns Hopkins Hospital, where you were a senior social worker in genetics for more than 20 years. And before that, you were a caseworker of the Jewish Social Service Agency and Family and Child Services, both in Washington, D.C. You were also an instructor at Georgetown University Hospital and an adjunct instructor in the Department of Social Work at Virginia Commonwealth University and the University of Vermont. So quite a lot of work. Lots and lots of accolades and recognition over the years, including you've received awards from the National Marfan Foundation, Neurofibromatosis Foundation. You also received the Nee Whitman NASW Mental Health Outstanding Achievement Award in 1999. You were listed in the Who's Who of American Women in 2000, 2001, and Who's Who in America in 2001. And you have lots and lots of articles published in the American Journal of Human Genetics, the Journal of Genetic Counseling, Health and Social Work, and the American Journal of Medical Genetics. You received your BA from Barnard College and your master's in social work from Catholic University, and you are an active member of the National Association of Social Workers since 1956. You served on their board of directors, and you served on their Social Work Pioneer Steering Committee, and you are also the chair of their work on standards, including genomics and genetics in the clinical practice of social work many, many decades ago when, again, it wasn't fashionable, and you really cut the edge there as well. In 1986, that coalition that you built in 85 incorporated in Maryland as the Alliance of Genetic Support Groups. And the board of directors had consumers and professionals on it. Greg Weigel was the president. Joan Weiss, you were also on the board, and the vice president for professionals. Abby Myers was on our board, and I recently visited Abby in New Fairfield, Connecticut, and she fondly remembered you and those days of being a founder of Genetic Alliance as well. We had John Carey and Jessica Davis and George McCoy and Joan Burns, all very important and powerful people to start with. And the first mission statement was to solidify and transform the energy of separate groups into power. And I would say that we, in fact, still are doing that to today, that we're still working on bringing all these groups together. It's important to say in 1986, the Maternal and Child Health Genetic Services branch supported the efforts of Genetic Alliance, of the Alliance of Genetic Support Groups. And we have Michelle Puryear here today. She took up the banner very shortly after her arrival there to give us that kind of support for many, many years, which I have to say, I'm sad to say we don't have anymore, but it's been hard since Michelle left there to have that kind of support. In 1988, the first empowerment conference occurred with Jane Macta as president, and 19 people were on the board of directors at that point. And you were formally named the executive director that year, and the bylaws and so on were established. You did a survey of the needs of people with genetic disorders, and that helped the board set its goals, which again, when I look back at those, they're extremely relevant. There's still needs. And on the one hand, that's sad. And on the other hand, it means that you really nailed it early on. Small groups joined, and lots of large groups were part of it. And early support came from the March of Dimes, from Margin, which was the Mid-Atlantic Regional Genetics Group, and then from the Council of Regional Networks for Genetic Services. We established the helpline, you did that year in 1988, and the helpline survived all the way to when Steve Groft and others at NIH thought it was so cool and so good that NIH should support it, and it actually moved to NIH. And I see we have Lois Lander on the screen here, Lois came when Mary Davidson was executive director and was part of the helpline then, and is part of what's called GUARD now, which is still doing great service for individuals with genetic diseases. You published the first alert with the March of Dimes support. That was all in 1988. In 1989, that was 88, 89, you published a guide to selected genetic voluntary support groups. That became Disease Info Search and still survives to today with some thousands of organizations as part of it. And we're very happy to have that compendium at first. And that compendium allowed genetic counselors to find advocacy organizations. So I know we have a number of genetic counselors on the Zoom today, Diane Baker, Judith Benkendorf, others here, Wendy Ullman, who appreciated early on that paper directory and subsequently Disease Info Search. And the first operating grant was given to the Alliance of Genetic Support Groups in '89 from the Maternal and Child Health Bureau, Genetic Services branch. And the first office was then created in 1989 at Stan Weiss's law office on 22nd Street in Northwest, operating with 3 part-time staff. And so thank you to Stan. I know that while we're celebrating Joan today, you've been backing her up all these years. And when Joan makes some comments later on, we welcome you as well, Stan, to make some. And even the evidence of your partnership in marriage as well as in these professional ways is quite moving and inspirational to all of us. In 1990, the first peer support training conference was established, and the Human Genome Project was established that year. So again, there's always that moment when I tell people that Genetic Alliance was established in 1986, and they say that's before the Human Genome Project was established. And the really wonderful foresight that you and Victor McCusick and others had to bring forward such an organization so early on is really critical. In 1991, there was an international gathering of networks of support groups sponsored by the Alliance, and that preceded the 8th International Congress of Human Genetics. And I'm happy to say there are a number of genetic alliances around the world now. That early conference helped other countries see that these kind of big, broad alliances made sense. And we have Genetic Alliance UK, Genetic Alliance Brazil, Genetic Alliance Australia, and so on. Sometimes it's a little confusing on my Google alerts because all of them come up, but it's really very cool that those all kind of came out of what you did and are the children, so to speak, of this organization. In 1992, the mission activities were supported by 5 staff, and the office moved to 35 Wisconsin Circle in Chevy Chase. And the Directory of National Volunteer Organizations was published. That was an outgrowth of the earlier guide. There were several conferences, Empty Pocket Syndrome Conference in Phoenix, the Human Genome Education Model Project, HUGEM had a meeting in Georgetown. And that was the year the Americans for Disabilities Act was enacted. And so that was a really critical piece too. And then in 1993, you worked on the legal and ethical implications of mapping the human genome in collaboration with Margin, and also healthcare influx. How will families with special needs fit in? And there was a genetic services branch grant for that as well. So we owe a great deal of our thanks in terms of our backing and support to the genetic services branch, and particularly to Michelle Perrier, who's here right now too. And then in 1994, you published Informed Consent Participation in Genetic Research Studies in collaboration with NORD. In that year, the bylaws were revised, and the mission was revised to give a voice to the common concern of children and families affected by genetic disorders. The president of the board at that time was Joan Burns, and we honor her and remember her, and are very grateful for her work too. In the larger context, we saw an explosion in the 90s of information and knowledge for both professionals and consumers about diagnostics and genetics garnering a sense both of hope and fear. Lots of media coverage of ELSI issues, that's ethical, legal, and social issues. At the same time, NIH earmarked 5% of the budget of the National Human Genome Research Institute for ethical issues, and Genetic Alliance of Genetic Support Groups played a great role in all of that. We saw managed care expansion. We also saw public access to information increasing through the internet. And we started to get the early pieces of the Genetic Information Non-Discrimination Act actually becoming important. And you published a couple papers with others on how important it was that we protect people's rights around genetics, a banner that then Mary Davidson took up and created a coalition. And in 2008, as we all know, the Genetic Information Non-Discrimination Act was passed after 12 and a half years of the Alliance leading the coalition that got that passed, called the Coalition of Genetic Fairness. And then in 1996 was the 10th anniversary gala honoring our founding director, Joan Weiss. The new executive director was named that year, Mary Davidson, who just made remarks here. We had a workshop on computers as networking tools. Little did we know that computers would be allowing us to meet virtually from all around the country and world here. Then we also, you held an international conference that Hugh Gem was the center of. You began and Mary Davidson took up the Partnership Project for Genetic Services pilot program, which I know Judith Benkendorf and others had a part in. And that was the first year, 1996, of the Genetic Alliance, the Alliance of Genetic Support Groups website, and email communications. So those were very big and very important foundational elements that have led us and been steadfast foundation for us over all these years. And we're really grateful for all of that. And again, that's a very short, small snapshot of the history and the leadership of Joan in very impactful terms. So I want to open the floor to anyone making comments. This will be a bit chaotic, and you can either shout out, raise your hand, put a note in the chat. We can try all these things. I'm not worried about this being formal or orderly in any way. But what I'll ask you to do once you do get the floor, so to speak, is to unmute, obviously, and speak. And I will spotlight you and Joan so that you can see each other as though we were in a real meeting, and all the people who are watching here can see. So the floor is open. Diane Baker.
Thank you, Sharon, for walking us through so many landmarks that this amazing lady created and led us to and through. Joan, I'm not going to talk about your leadership, but I'm going to say when I close my eyes and think of you, there are two things that come to mind. The first is elegance. Every media opportunity, public speaking, event, gathering, one-on-one meeting, you always walked in with grace and elegance and beautiful posture. You were a model for all of us about how to present ourselves to the world. And that is certainly something I took away and appreciate. The other thing I think about for you is your laugh. You have a beautiful and welcoming and I would say attention-getting laugh that draws people in. And I just want to recognize and thank you for your elegant laughter.
Thank you, Diane. And I would mention that Diane was on my first board of directors, and she was always very busy taking photographs. She was a wonderful photographer. And also, she did not mention the fact that she is Francis Collins' wife. And we're very disappointed that he won't be here today.
As is he, Joan, as is he. Thank you. I open the floor to the next speaker.
Thanks, Diane. I have Dean next. Dean, he'll tell you who he is.
Yes, my name is Dean, sir. I'm with MLD Foundation. Joan, you and I have never met that I recall, but I am the MLD Foundation, and so many other organizations are the beneficiaries of the work and the groundwork that you laid out in front of us. Most of my interactions with Genetic Alliance have been through Sharon, and I would echo Diane that the history that you shared is so important. And as I look through the grid on my screen, so many faces that I know and so many faces that I don't. But history is important, where we came from, what we've learned, what worked, what didn't work, and particularly the networking that has occurred. Our first connection in the rare disease space, of course, we're rare disease parents, so we came in through that door, but was through Genetic Alliance. And you saw that picture of Genetics Alliance Day on the Hill, 2007. I'll never forget that. What in the world are we doing in Washington, D.C.? And I got to tell you, I am 3,000 miles short of 75,000 miles of travel this year, getting back and forth to D.C. and places like that, still carrying that torch. So I just want to thank you for the groundwork you did and the wonderful ladies that have followed you in leadership, and of course the dozens and hundreds, really hundreds of other organizations that are bonded together because of your work. So thank you so much.
Thank you very much. Yeah, I'm very happy.
And thank you. Now we're going to hear from Steve Groff.
Hey, Joan, it is so great to be here and with you and with everyone else. I was so excited that I actually tried to link in last week. I thought
He did. He was the only one here.
Yeah, I was the only one there. It's like, what am I doing? I have to read the memos a little bit more closely, But it's been such a pleasure to work with you. I really can't describe it because I mean, so many words have been said already. More will be said as we go on. But, it was so much fun. And yet the challenges were so great that we never let the challenges stop us from having as good a time as what we could have with all the difficulties we were facing. But you always came into those situations with we can do this. We can make things better. And I think that attitude and behavior has spread to so many of the patient advocacy groups. And you were the leader of many of those organizations and showing them how to succeed and how to get things done. I think if we had a rare disease Richter scale, the things that you did at different times, maybe it was a 7, 8, or 9, just causing such wonderful chaos and support by so many that you were able to have them understand what the extreme needs were of so many people. And we can never thank you for that. It's just been so fabulous. And I count myself so fortunate that I was able to work with you. And then for so many years, and then with Mary and Sharon and so many others here. How blessed and how fortunate can one person be and many people be to have worked together with all of you. And it's been super. I keep saying, what happened? Why did I deserve this? But thank you so much. And I'll turn the microphone because I could just keep going all day, as some of you know, but I won't do that. Thank you, Joan. Thank you. What an experience. What contributions. Tremendous. The world will always remember you, and thank you for what you've done.
I so appreciate your words, Steve, and I enjoyed working with you too. And I know you've done wonderful things too.
Thank you.
Great. All right. Who's next? I'm gonna see all of us so I can see who's unmuting. Nancy.
Unmute.
There she is.
Well, I am thrilled to be here. I'm not a part of the genetics support group world, but I've been a part of Joan's world and she a part of mine since nursery school.
Right.
As well as that our birthdays are 9 days apart. And I just have to tell you, Joan, I am so proud of you. I have always been proud of your friendship, but hearing what everybody says, but of course you didn't tell me half. You didn't tell me any of these things. And so it's just a thrill for me to hear in what esteem you are held, and to wish you happy times and more good painting times the way we have, and to send you my love and a big hug. I mean,
Thank you, Nancy.
we go way back.
We sure do, but we still keep up together.
We
Paint
do. We do. We paint together.
wonderful artist. She does
Wonderful
wonderful
time.
books. She writes them and she illustrates them. So go out and get a Nancy Patch book right away. For your
No,
grandchildren.
Joan, this is your day. Thank you. Thank you, everybody, for all the beautiful things you've said about Joan.
Wonderful. Thank you. And at some point, you might want to say how old you are, Joan, because people may think looking at you that we're talking about 70s or 80s, but maybe at some point you and Nancy can out yourselves.
Shall I tell you how it was described in a recent moment for me? That the speaker just said that I was born in 1930.
Oh, then everybody has to figure it out for
And everybody
themselves.
has to work on that subtraction.
Good way to do it, Nancy. 1930 is my birth date.
That's right.
Yes.
How do you figure
Yes. Yeah. Yeah. So that we can celebrate that as well. That you are very vibrant and give us who are a little younger, not much, some view of what
Sure,
life
we'll celebrate
how
that.
full life can be. All right. Thanks, Nancy. I have next Judith.
Judith, where are you?
I'm
Here she
somewhere.
comes.
Here I am. I'm in Santa Fe, New Mexico. So Joan, I attended the conference in 1983, and it was totally memorable. The themes just really resonated with me. I remember Beverly Sills was the lunchtime speaker and Patricia King was pregnant. So that's how far back we go. Anyways, I was at the University of Miami at the time, and in 1986, I moved to Georgetown and was the high-risk OB genetic counselor. And there was a patient who had delivered a baby, and at the time she was in postpartum, it was discovered that she had Marfan syndrome. So I thought, all right, I'm not going to let her go home without talking to Joan Weiss. Now, I had never met Joan Weiss, except seeing her at that conference. And I was a little intimidated, but I picked up the phone and I called Joan Weiss and I said, Joan, we have a woman here who's just given birth and was also told, along with having a new baby, that she has a diagnosis of Marfan. And you came that afternoon. I remember exactly what you were wearing. I remember your hairstyle that day. And I remember that you walked into her room and you had a good meeting with her and gave her some resources. And we all felt confident that things would follow up. And from there, a wonderful personal and professional friendship developed. And over the years, you and I traversed the country, and I still have a folder that's called, the title on it is On the Road with Joan Weiss. And it has many outlines of health professional training workshops we did from New Orleans to NASW pioneers to social workers for Montgomery County. And we went up to Havre de Grace and we talked to allied health professionals all over the state of Maryland. And we even did something for your neighbors. And one of the best parts of it was that you believed in, I don't think anyone's actually mentioned this, that you believed in interactive learning. And so we did not just get up there and tell all of the people we were training everything we knew. We got them involved and they broke into small groups and we had cases for them to discuss. and we had them to break into dyads and interview their partners about issues. And we had a genetic testing exercise where they would open an envelope and find a genetic testing result. And then we had open discussions about the reactions to that and who they would tell and whether they wanted to know and what characteristics of a disorder might affect an individual or a family differently and decision making, and really brought out not only the human side of it, but the complexity and the nuance and the fact that genetic disorders affect everyone in the family, regardless of their genetic code. And that every situation is personal, every situation is different, and we all bring who we are to that situation. And when, we don't always win the genetic lottery, there is a huge safety net through Genetic Alliance to help people along. So thank you for everything. Thank you for being my Washington, D.C. mama. Thank you for all the dinners you served me, the Jewish holidays I spent at your house, but mostly thank you for being a role model and for everything I've learned from you. I love you, Joan.
Love you too, Judith, and thank you so much. And I love doing the workshops with you. And one thing you might have forgotten to mention is we usually had a consumer in our workshops.
Oh, that's right. At least one.
Important.
Thank you for mentioning that.
Thanks for all that you gave to the cause and all the times we've spent together, and we miss you, Judith.
I miss you too.
Wonderful. Thank you. All right. Next up, I have Ruth.
Ruth. Hi, Ruth. Just
We'll unmute you, Ruth Gottesman.
Okay. Can you hear?
Yes.
Okay.
Yes.
Okay.
Yes.
I just have to say, I'm here. I'm Joan's first cousin, and this is my sister's niece, Sue Patz. And we are just thrilled to hear all these accolades, which we knew, of course, but to hear them from all of you makes it really special. And we just want to add our applause. We are so proud. We are so proud of Joan, and we just have to shout it out. Shout. Okay.
Shout. Thank you, Ruth, and thank you, Sue, for being here.
Great. Thank you, Ruth and Sue. And now Wendy Ullman.
Hi, Wendy.
Oh, you're muted, Wendy.
Can you hear me now? You hear me
Yes.
now? I am thrilled to be here to honor Joan, and I am here because of Joan. And it actually started with my great aunt Rose, who was a formidable woman herself, Rose Lightman, and she was a social worker. And Joan, if I have the history correct, you both worked at the Jewish Social Services Agency.
That's correct. Yes, correct.
Together, and my great aunt actually, so she lived in the DC area as well, and I came home from one of my breaks, and she said, what are you thinking about? What are you interested in? And I said, well, I've read about it, just a line in a book here about genetic counseling. I think I want to try to find out more about that. And Aunt Rose said, you've got to meet Joan. And so that is kind of really where my journey started, was meeting Joan, who I think you connected me with Karen Greendale at George Washington University.
Right.
And then I also had the good fortune to do a winter term with Diane Baker, who's very much been a role model to me. Both of you have been, in addition, so I think that both of you is really leading me down the pathway for genetic counseling, and really supporting me on that journey and encouraging me. And so very much a lot of gratitude to you. And I always enjoyed seeing you at the different meetings over the years. And then that the book that you ended up writing on starting and sustaining genetic support groups, and I pleased to also see Jane on the screen as well. And I remember I had the opportunity to review the book proposal for it, and then to write one of the reviews. And I just found the review where I said, programming, fundraising, networking with researchers, and communicating by internet are just some of the useful topics covered in this highly informative book. Anyone reading, starting, and sustaining genetic support groups from cover to cover will have the knowledge necessary to both start and maintain an effective support group. And this was so much a novelty in that day. Remember, we did not have the internet. So we really relied on books like the one that you wrote. And we also, as genetic counselors, really relied on the Alliance and, supporting our meetings. And I think one thing that I would just add to Sharon's rich history is the fact that that you used to come to our meetings with these cardboard stand-ups that would have brochures from all the different genetic support groups in the country. And as what would happen as genetic counselors is that we would actually make sure to wake up as early as we could to be one of the first ones in line to go to the Alliance support group booth. I guess, is it a booth you call it, or stand-up you would call it at that time, and to take one of each brochure. And then I guess this is being recorded, but I think I'm past the whatever the period of being prosecuted, because I think we then across the country, all of us broke copyright laws to copy the single copy of the brochures that we had brought back to our institutions. So that we could provide support materials to our patients. So I think, remember, just thinking of the early days of genetic counseling and just being told that you have a genetic condition, and really key to that was wanting to link people up to supportive resources. Phone calls were expensive. There was no internet. Even Xeroxing something, you had to pay per page. And so, like I say, with a lot of gratitude, and I don't even know if our field, fully, remembers this history, which is why, Sharon, I really hope you'll write this up and make this really accessible to everyone. But we really did rely on those brochures and everything to be able to provide to our families. And Joan and Mary and Sharon, I mean, it was all of you that had that vision of knowing that that being able to connect with people and being able to connect with others that live day to day with genetic conditions, and the power of doing that, and the resources that people have. And so it's not just providing support, but giving support at the same time. And I just, it's like I say, I think that that's so much what you did kind of brought together the whole community. And I know that my career, like I say, was enriched by all of you, and to also really in just the whole power of connecting with each other. And so I am, like I say, just very joyful to be here today. I'm speaking from the heart. I didn't have anything written down. So I hope this has been somewhat clear, but I just really want to express my gratitude to you, which started really with a phone call based on my Aunt Rose's recommendation, and really steered me to the North Star. Both you and Diane, especially for my profession. So just want to thank you. And I should probably quickly add to that that just to show that since in genetics, we'd like to go up and down generations. So I guess I have to go up to my great Aunt Rose, but then I have to go down to my mother, who came home one day and said, "Oh, you'll never know who I met. I'm part of a woman's, a women's retirement group." And so Joan and my mom ended up connecting in this high-powered women's retirement group. So my gratitude to you, very much my gratitude.
Thank you. I just want to add, Wendy, you might not remember when you first met me, came to our house, you were in the den, and at that point you weren't decisive about whether to go into social work or genetic counseling. The more I talked to you, the more I realized that genetic counseling was for you, but it was really hard for me to encourage you to go into genetic counseling rather than social work. But you've done wonders with your profession.
Thank you so much. Thank you so much.
Wonderful. I'll say, while I'm switching the the speakers around, and also recognizing that some people in this are putting in the chat that they're up next, so that we have next Betsy, then Marjorie, then Virginia, that I read starting and sustaining a support group from cover to cover the year that my kids were diagnosed in 94. And it did launch PXE International into the world and me into this career, which I never signed up for, but I'm very grateful for. And that, yes, what you wrote, Joan, was just phenomenal. And you know that we then used it as a basis of writing a wiki called Wiki Advocacy that took a lot of what you had done and added some of the internet-y kinds of things. And that also I'd learned from Mary Davidson how to pack up all those brochures and lug them with Mary to the conferences, carrying on the tradition that you had established. So really terrific. All right, Betsy, you are up next.
Hi, I do not work in the field of genetics or genetic support groups, but I'm Joan's daughter. I'm going to keep my remarks pretty short. Feel definitely influenced by my mother, who I love so much. And Mom, I'm so proud of you. I definitely, just being your daughter and seeing the work that you were doing as I was growing up, it really shaped my view of the world, and I think made me a better person. I love you.
Love you too. Yeah.
Thank you, Betsy. And we can see looking young runs in the family.
And she has a social work degree, by the way.
That's right. Yeah. Wonderful. Great. All right. Next up, I have to just remove the spotlight to find Marjorie. Let's see, Marjorie, where are you?
I think I'm here.
I think you are too, but I can't see you. There you are. Good. I'm putting a spotlight on you and the spotlight back on Joan. Great.
Betsy Weiss is a hard act to follow, but this is from me in Somerset Building 1 to Jono and Stan, all the way across the courtyard in Building 2. I have a couple of non-professional observations to make. I've been tremendously impressed by previous speakers who delivered in much greater detail than I ever understood the contributions that Joan has made through all these years. But if you go back from 1988 and 1989 to 1938, 39, I would say that's when I first became acquainted with Jono. In third grade, Jono and Nancy were in the 3A section, and I, being several months younger, was in the 3B section in the years when Baltimore had divided classes according to birth dates. And we read Mary Poppins together. I'm trying to think if it was Miss Pistel. Nancy, help me out. I think Miss Pistel was first grade. Mrs. Kling, I think, was fourth grade, but who was our third grade teacher? I can't remember. But anyway, along the way, through high school and part of college and living here in Washington and onward, it's been a long and fruitful and wonderful relationship, which I hope we will celebrate New Year's Eve together, as we've just made the plan this year, as we have last year and perhaps before. And I would just like to add, for those who attended that wonderful dinner in the hotel, maybe it was the Hyatt, downtown in Washington, when Francis Collins, and we are certainly sorry to miss him here today, between the drinks in the cocktail room and the seated dinner in the dining room, down a long hallway in the hotel, was a stairway up to the main lobby, in which Francis Collins, then actively director of NIH, stood with his guitar and serenaded Jono. And I have sung this many, many times since then, but I'm afraid I can't get past the first two lines, but I'll do it now because Sharon and I emailed about this. And Francis Collins sang, Jono Weiss, Jono Weiss, she's the one we remember. And beyond that, I can't go. Rutho, you and I could do this together. I'll cede my time now, but with great affection and
brings back a lovely memory.
congratulations to Jono and Stan. See you
Thank
soon.
you so much, Margie. I remember that song very well.
Well,
Yes.
Sharon and I couldn't get the lyrics past the first two lines.
Something about she's so nice.
Oh,
That's
good
right.
for you.
Yes,
Thank
yes.
you.
And Francis had hoped to come today and reenact it and probably update it, but he had a Schedule C meeting for progeria with the FDA, which, you can't argue with it. They're at the point of having drugs that are in Schedule C, a Type C meeting. So, all right, thank you, Marjorie. And now I'm going to find Virginia Lapham. Here you are.
Yeah, right. Okay, Joan, we've had quite a time together over the years. We share both being social workers and our age.
Right.
But I came to Georgetown as a social worker in 1984. And Terry, I was listening to all your dates because I was sure I thought the original organizational meeting of the Alliance was at Georgetown in 84. And I was a newbie and just invited to attend and was very thrilled to see something going on. I did not have much of a background in genetics. I kind of came in the back door. The Methodist Church had a genetic science committee starting in 1988, and I was asked to be on that committee that learned a lot about genetics over a lot of miles and places. And it was during that time that also met Francis Collins when he was at the University of Michigan. But anyway, Joan and I got to know each other as social workers. And then when the Human Genome Project was funded, and we knew that some of the amount was for the ELSI issues, there was a Methodist working in OMB that said, nobody's applying for this ELSI money. Why don't you do it? So I got in touch with Joan, and the third time that we applied for a grant, we got it. And we started out in Huge M1, focusing on both professionals and consumers, as I guess we thought we were teaching both of them, but we learned very quickly that consumers knew more than the professionals of that day. And so Huge M2 had then the consumers as teachers in every single panel that we had. Right, Joan?
That's right. We did that.
And we did a survey. Somewhere along the line, Judith Benkendorf joined us too. It's always good to see you, Judith. But one of the things that we published, one of the articles about consumers experiencing discrimination in education, health. What was the third thing, Joan? Anyway, health was the big controversy, and the Health Insurance Association of America really was unhappy that we published this. And Stan got involved at this point and did some data gathering and analysis because the Health Insurance Association, I think, said that we were not accurate, something like that. And anyway, Stan helped us out there. Thank you, Stan. So those were big days, right, Joan, when we were really at the forefront of the Elsie issues, and certainly involved with a lot of interesting people, and went all around the country to national health organizations to try and involve them in understanding and being at the table when the project actually got funded. So, Joan, it's terrific. We've stayed in touch over the years. We're grateful to still be here, right, Joan?
Yes, we are indeed. We are.
That it's really a pleasure, and I always credit Joan with the reason we were able to get the grants. I was pretty much, I had the professionals in my orbit, but it was the consumers and Joan that really got us on the map, particularly after we published in Science. So, Joan, thank you.
Thank you, Virginia, for all the work you did with me.
Right, we had a good time, sure.
We managed
Yeah.
to.
Yep, absolutely. Kudos to you too, Virginia. I appreciated when I met you and saw all you had done. The two of you have really changed the world so that we have something to stand on. So thank you.
Oh, well, thank you.
And it's also significant that we have 10% of the people on this call are 94 years old. That's kind of amazing.
Oh, wow.
We have a message in the chat that Margaret Chen, Joan, cannot unmute or take her video off, but that she always has the fondest memories of working with you at the Alliance, and you inspired her career in the field of genetics.
She's wonderful, and she's done well.
Yeah.
Best to her.
Great. Okay, I don't have anybody else in the queue. Somebody else wants to speak? Let's see. Helene.
So I am Joan's sister-in-law. So I know Joan in a completely different way. And I'm always very emotional, so you'll have to excuse me.
No, go for it.
We lived through the era of Jonathan. We supported Joan in everything we could and everything she wanted to do for the Genetic Alliance. But we've kept in touch over the years, and she's been very supportive of me and my family. And I have to say that if I could have handpicked a perfect sister-in-law, it would have been Joan. She knows that I was very naive and very young when I married her brother, and she put up with a lot of stuff from me, believe me. But we followed her career, and I have to say, she never talked about as much as I've heard today of what she was involved in. So knowing Joan, her hand will always be in helping people. And that to me is part of the love for Joan, is her care for people.
Thank you, Helene.
Helene, thank you.
But can Stan say anything?
Yes, of course. Yes, Stan.
It goes without saying that I'm very proud of Joan. There aren't too many organizations, particularly social welfare organizations, that survive with their founders, but this one certainly has.
Right.
The thing that I found most engaging and rewarding through Joan was that my contact with many of the people with genetic diseases. It's amazing how brave and how forthright these people could be. I remember the young lady who had Marfan's, who insisted upon dancing in Broadway shows, where she could have killed her.
Julie, yeah.
I remember meeting some of the OI people who had 30 surgeries by the time they were 20 years old. I think all the people working in this field deserve an enormous amount of credit for helping those who need the help. And I'm very proud of the fact that my wife was one of them.
Thank you. Thank you, Stan. And thank you for your support. We know that both very materially in terms of the things that Virginia described, as well as moral support for Joan over all these years has been critical. This is probably a wonderful segue into Joan, comments that you would like to share other than what you've shared with us already today.
Well, I just, it's hard for me to have the words to express my gratitude for, first of all, for Sharon Terry, that she has kept the Genetic Alliance of Genetic Support Groups alive all these years. And she's run with the ball. She has gone into future projects that are mind-boggling. All the genetic alliances that are now all over the world that are serving these families with genetic disorders, as well as connecting with the health providers and scientists and researchers. Sharon, I admire you so much, and I am such gratitude for what you have done to keep the Genetic Alliance going and healthy. And I foresee a future. So don't go anywhere. You got to stay here because you have done such a marvelous job, and I so appreciate it. And as far as the remarks today, they have moved me tremendously. All the people who have influenced me along the way, the friends, the relatives, the health professionals, all who have spoken. It's been so moving and brought back a lot of memories that I sort of had forgotten of things I did early on in my career as a genetic social worker. So I thank everybody who came today, not just the ones who appeared online, but those who are here, and my family, my associates, all those who have been supportive of me all these years. I can't tell you how much I appreciate your being with me and supporting me and being there for me when I needed you. So thanks to everybody who is here today and those who couldn't come today. I thank you from the bottom of my heart.
Wonderful. Thank you, Joan. We have lots of comments coming in via email, via a form, and also in the chat. And we will be putting all of those together so that you can have them all in a coffee table book along with the photos that came in. So we're still open for more photos coming in. We're open for more comments for sure. I want to kind of close the formal part of this this morning, this afternoon, this evening, depending on your time zone, by thanking you, Joan. And I think I want to say in a sort of bridging way that as I said, I learned to establish my own support group by reading your book. Nonprofits often don't survive. Somebody else said this very well after the founder leaves. When that vision goes, it's really hard to keep it alive. And so I also want to add Mary Davidson to this equation in the sense that she learned from you, you passed the baton to her, and she was able to keep the spirit and the fundamental mission of this organization alive. So that for me, it was very easy working hand in hand with Mary all the years that I did as on the board before I assumed the leadership, to also embody, inculcate, absorb, digest the mission that you had so carefully laid out and that Mary kept alive for all those years, a decade. I also learned to write from Mary Davidson. I was a terrible writer when I go back and look at the things I wrote as a board president. It was pretty bad. And Mary, probably largely due to her own incredible ability to write, as you saw with what she read for you, Joan, as well as her editor husband and also legal husband. Again, we have another husband who worked for Genetic Alliance, which was really terrific. So hats off to Matt. I know he's around there somewhere. So great thanks to Mary too, because I think an organization doesn't stay alive unless there's the leadership gets the spirit of the mission. And also to your point, Joan, and building on what Mary built, consumers, lay people stayed and are absolutely central to the Alliance still to this day. We both, Mary and I both picked up that banner and held it high and ran with it, even in the times that, as Steve Groff said, there was a lot of adversity, and there still is occasionally. There's still the wrong language, and there's still the wrong, the lack of reception, and so on. So I want to say too that our current staff, unfortunately, are all in meetings at this moment. I waited too long to ask them to say anything, but they also want to express their appreciation, because you're right. Some of our programs now are kind of astounding, and they are because they grew out of what you laid down and what Mary continued. A program like I Hope Genetic Health, in which we are diagnosing undiagnosed kids in remote parts of the world, so marginalized communities in Ghana and DR Congo and Peru and Brazil. And those kids are getting diagnosed and coming right into the systems that you built. So they are finding the support group through us. They are connecting with the clinicians who are expert in that disease. They are getting into research programs and clinical trials. That program is astounding. We just heard from Illumina, which gives us free reagents to do it, that they will support us to the tune of $250,000 more this year. They gave us $500,000 last year. Alexion this morning just announced that they would give us $50,000 toward it. And actually, a number of donations came in your honor, Joan, that were quite substantial to use for Genetic Alliance current mission activities. So you're right. We are thriving. We are healthy. We are continuing. And we're using all the pieces that you and Mary built about, we don't have brochures anymore, to Wendy's point, and we're happy to have them plagiarized, by the way, but online services that we offer so that families can find what they need and that researchers and clinicians can get it, that people are really the center of what they are and should be doing. So phenomenal. I mean, I could get emotional too and say, I am so grateful for all you did and for the inspiration that you still are today for me and for so many people. So thank you.
And thank you so much, Sharon, for what you're doing and continuing to do. I'm very grateful that you are carrying the torch, as they say.
Yes.
Carrying
yes.
Right.
Yeah. Well, thank you. Thanks to all, because it is true that everybody here actually made this possible. It was and is a family. It's a village. It's a community. And that's been really critical all along.
Right. Yeah.
Great. All right. So I'm going to leave the Zoom open for just chatting. I'll take all the spotlights off so everybody can see everybody. And everybody can remain on as long as they want to and say anything they want in a formal or informal sort of way. But maybe everybody could unmute right now and give a round of applause to Joan, which sounds terrible on Zoom, I know, but I think, and any shout out or anything else anybody wants to do. But yes, so standing ovation, Joan. I can't stand up because I have sweatpants on, but other than that.
Thank you so much, everybody. You mean to me, to everybody who's here and those who are not able to be here. Thank you so much.
Okay. I have to leave.
Oh, I see Jane Macda. I didn't see you earlier. Good to see you.
Oh, where's Jane? Jane, raise your hand.
Hello, Jane Macda.
Where is
she?
Oh,
Judy?
Jane.
Wendy.
Good to see you, Jane.
Let's see. I'm gonna put Jane on the spotlight for a moment.
Oh.
Hi, Jane.
Hi.
Oh, Jane,
Jane was, I think, our first president, weren't you, Jane, of the Genetic Alliance?
After Greg.
Oh, yes, Greg Weigel was the first, and he didn't last too long, and then along came Jane.
Yes, and
Oh.
lots of years, Jane. Yeah.
Well, we had so many wonderful memories, and we did so many novel things, mostly because of your vision, and I like to say your big heart. There was nothing and no one that didn't benefit from Joan's compassion and caring and her connections. She was always ready to share people she knew, doors that she could open, and it was my privilege to follow her lead and to learn so much from her. We really shared on a personal and a professional level so many life-changing moments actually for us. But the main thing that I really want to comment on, after all the many apt comments and well-deserved comments that came from everybody, was the fact that Joan had a talent for recognizing everybody's special skills. She brought out things that people didn't even know they had, so that consumers, parents, families were really elevated to a place in the community where they were treated as equals, where they had something to share and to say, that we really worked so hard to get people to listen to them. And it was your treating everybody with respect and dignity that gave people the wherewithal to go through really challenging and hard times, because they were part of a greater community of caring and sharing and great love. And you were really the spark that made it all happen.
Oh, Jane, thanks so much. And you did help me. You were a wonderful president of the Alliance. And second president, maybe that's true, but you gave so much of yourself and meant a lot to the beginnings of the Alliance of Genetic Support Groups. And it's wonderful to see you here today. Wonderful.
And I just would like to add that I was going to leave that song
Francis Collins song?
Yeah, that Francis sang, and because it's in my head all the time. So I hope
Tell
everybody
that to your husband.
yeah, that can carry that with you and remember this marvelous, marvelous tribute.
Yes, I will remember it as long as I live. Time will be. It's been a wonderful tribute. And I just thank everybody who was involved here, and particularly Sharon Terry, who got this going in the first place.
Absolutely.
So glad we could. All right. Anything else? Anybody else? Great. We will, Grace, go ahead. You're muted.
Can't hear you.
Yeah, see if you can find the mute button, Grace, because we can't hear you.
She and I have the same problem.
It's hard. Yeah.
Hey, unmuted.
Oh, good. You're unmuted.
Yeah, I love you, Joan, and I'm so proud of you. And I want to say, of all things, that I just find you so upbeat and so motivated to keep doing things despite any little, gaps there have been these last few years. You just keep going, and you're so motivated to do. You are a doer and a follow througher. And I just admire you so much in every way and all that you do. Thank you for being such a good friend.
That's so nice, Grace. And I admire you too, we're mutual admirers.
Yes, yes.
We've done a lot together. Grace and I are both pioneers of the National Association of Social Workers, which meant a lot to both of us, I think. So,
Yeah.
and as well as being friends and neighbors and fellow artists as well. Thank you so much, Grace. Thanks for being here.
Thanks for being you.
Great. I think I miscalculated my percentage of people over 90. It's higher than 10%.
Oh, really? Oh my gosh. Oh, wow. Will you have a list of the people who were?
Yes. Yes, I'll put that. I'm gonna make one of those Shutterfly coffee table books, Joan, and I'll put all the photographs people sent in. Lots of people wrote good wishes that couldn't be here today. I'll put those in. The comments from the chat, we'll put those in. We'll put the names of everybody who was able to come and who wished they could have come. So we'll put all that together.
Thanks a lot, Sharon.
Yeah, and I'm very happy that your friends and some of your family were here as well, because again, this is about friends and family, and our work is absolutely supported by those that love us these ways.
Absolutely. I really was glad that some of the family and friends, lots of friends were here today too.
Yeah, fabulous. All right, all our friends, the family of Alliance of Genetic Support Groups, thank you all. Thank you, Mary, for kicking us off.
And it just seems very appropriate as we approach Thanksgiving, to really be able, I'm very thankful, like I say, very thankful for Joan, also very thankful for Diane and for Mary and for Sharon and for others on this call as well. I mean, what a journey we've been fortunate to be able to share in our lifetime. And so just feel a lot of gratitude. And it's really, really nice to be reminded of all the positivity and everything, Joan, that started from scratch. I mean, it's one thing to build, when you have nothing to go by and you're just starting something from scratch. I hope that's a story that our community can really appreciate. And like I say, I think both Mary and Sharon, the directions that you took the organization that we couldn't even have thought of, and still have yet to think of. I do think AI is going to be transformative. I do think genomic sequencing is going to be transformative. There's so many, all the different omics. There's so much coming at us. But like I say, I think more just in the spirit of Thanksgiving, just wanted to really leave a sentiment of gratitude here from Michigan for all of you.
Thanks, Wendy. Fabulous. All right. Thank you all. Have a good rest of your day, and let's take gratitude out into the world for all.
Okay. Bye, everyone. And thanks again. And thanks, Sharon.
Be well.
Thank you.
Thank you. Well and strong. Carry on.
Yes.